Maybe you, or someone you know, is considering undergoing testosterone therapy to become more masculine in appearance. This video is going to focus on the effects of taking testosterone. It is a powerful hormone which will change your body in many ways. First, I'm going to talk about the permanent changes that testosterone, or T for short, will make to your body. These changes don't happen overnight. Instead, they increase over the time that your body is exposed to T. Eventually, your body will reach its maximum level for each of these areas, but where you will max out is dependent on your genetics, health, and body chemistry. Stopping T will not reverse these effects once they have taken place. There is no set order that these changes will occur in, and it will vary from person to person. First off, testosterone will cause you to develop facial hair. Testosterone can cause male pattern hair loss. This is very dependent on your genetics. If you start experiencing this, you can talk to your physician about options to fight it. Testosterone will cause your clitoris to get bigger. The amount of growth varies from person to person, but about an inch is common. Testosterone will cause your vocal cords to thicken, and your voice will get deeper. If you are still in puberty, you may even develop an Adam's apple. If you are past puberty, this is unlikely to happen. Testosterone will increase and lengthen your body hair. How much depends on your genetics, but it's not uncommon to see more hair on your chest, back, butt, legs, arms, hands, and feet. Nose hairs and eyebrows can even be affected. Now I'm going to talk about the non-permanent changes that testosterone can cause. Again, the amount you will experience these changes is based on your genetics, health, and body chemistry. If testosterone is stopped, these changes will be lost or reversed. Testosterone will trigger your body to increase its muscle mass. When T is first started, the body's drive to add muscle leads many individuals to experience increased hunger and the need for additional sleep. The buildup of muscle, even in small amounts, can cause the shape of your face and body to change subtly. It can also increase the size of your hands, feet, and neck enough so that your rings, shoes, and shirts may no longer fit. Testosterone affects where fat is deposited in your body. Fat deposits that you had pre-T will not shift, but any new fat that is added to your body will be deposited in your stomach area mainly instead of your hips. Testosterone can cause changes to your moods for a couple of reasons. If you have functioning ovaries prior to starting T, your ovaries' production of estrogen will slowly decrease while your blood levels of testosterone increase. This can cause menopausal symptoms for several months, which includes moodiness. After several months of testosterone, though, this frequently levels out. Many people report they feel much less moody overall after being on testosterone for many months than they ever felt prior to taking it. Testosterone will not cause roid rage. A person's tendency to fly into a rage when angry is more a function of emotional maturity and is not increased by testosterone. How a person behaves pre-T is a pretty good indicator of how they will behave post-T once their testosterone and estrogen levels have shifted completely. Because testosterone causes your ovaries to turn off, your periods usually stop after 3 or 4 months of being on T. If testosterone is stopped and your ovaries are still present, your periods will begin again if you are premenopausal in age. Testosterone will cause the sweat and oil glands in your skin to become more active. This can cause acne, which may or may not improve after your body adjusts to T. A physician can help minimize this if it becomes an issue. Also, the decrease of estrogen in your body can cause your skin to lose its subcutaneous fat layer. This layer of fat just underneath the skin is frequently associated with the softness attributed to a woman. Once this layer is lost, muscles and veins are easier to see beneath the skin, and this can affect your overall appearance. Testosterone will increase your body's production of red blood cells. This helps to move oxygen into the additional muscle that testosterone builds up, but it can affect your blood pressure as well. If you have a history of high blood pressure pre-T, it is especially important to see a physician to monitor this when testosterone is started. Testosterone will cause changes to your sweat, urine, and skin odors. It will also change the scent of your private region. This area will lose its female scent and take on a more masculine scent. Most people report that their libido increases significantly when they begin T. Depending on the way you take testosterone, your libido can continue to fluctuate, being increased right after taking testosterone and then decreasing slowly until the next dose is taken. Please remember, because of all the changes that do take place when starting testosterone, it is very important you are monitored by a doctor to make sure that no long-term health issues arise. If you would like more information regarding testosterone, there are many good websites and books you can refer to. Here are a few to get you started.